I'm Dr. Leo Powers, and I'm from Plover, Wisconsin here. And this is our phone number, 715-341-7102. Today, I'm going to talk about Dupuytren's contraction, or another name for it is hand arthritis. And so when you have this, the muscle, the fascia between the bones in the hand bones in here, is contracted. And I've learned how to treat it successfully, where it goes away completely. And from the patients that I've worked on that it's resolved, you have to work on the hand bones and the foot bones. And there's two parts to the body that they divide distress in the Chinese medicine, yin and yang. And there's yin in the hand and yang in the foot. And so basically what happens is the fascia, the muscles of this area right up in here, and the best pictures, they'll pull back like this, and they bring their hand back like that, and they have to have fine coordination in the hand when you bring your hand back like that, so they can fire it at 90 miles per hour. And so when you pull that back, I've studied touch for health and applied kinesiology and the sacro-occipital technique. And so when you pull it back, there's several muscles that get stretched, and when they stretch the muscle, that activates the fibers tied in with the organs connected with it. So this is an intersection point right up in here for the gallbladder, the ileocecal valve, the liver, the colon, and there's the lung. There's several intersection points right up in here. And so when you pull it back like that, then I can adjust the hand bones and foot bones and release that tension that's in the hand bone right up in here. And I've studied sacro-occipital technique and worked with it since 99. I started studying it, 1999. And in 2000, I attended some seminars and learned how to adjust the endurance part of the head. And that has to do with the top of the head, that's a parietal area. And basically, there's a drainage port along the top here, and you can activate it tied in with any muscle in the body. And so when you bring this back like this, sometimes it's on the right side, sometimes it's on the left side. When you bring it back, then you can do adjustments that will activate this. And there is endurance adjustment for the muscle. It's called a gamma 2 fiber. And so what you do is you pull down lightly on the head, and you have to block the pelvis with something, to make it move, because it moves real easy when you block the pelvis, and you have to block it for yin or yang. And so then a lot of times you pull it up for the yang part, and then you have to lift along the top of the palate up in there, and then that lifts the nasium, and then that lifts the sphenoid bone. This is the yellow one here, and then that lifts the top of the head. And so it's kind of like the roof of the head is right through here. And what happens is when this muscles are out of balance, then this fascia, it droops and sags. And so we reverse that process so it doesn't droop and sag tied in with these fascia. And then the muscles of the hand and the fingers are up in the forearm, but some of them are up here because there's a thoracic outlet that goes down to the hand from there. So we have to unlock that. And then it takes several visits to unlock it. It's not like one visit, it's a series of visits. And to know how many visits it takes, you'd have to come in and I'd have to check. And if you have indicators that shows that would fix it, then I could communicate that, but you'd have to be checked. So there are lots of muscles in the body, but the muscles connected to the hand are, right up in here in most cases that I've checked, and people have gotten over it. So basically, there's two adjustments for the head. One's for yin, one's for yang, and one I pull up and one I pull down lightly, and it's really light pressure. It's like less than what you to blanch a fingernail. That's about 4 pounds. That's about 4 pounds here, and it's about 1 to 2 pounds. So it's very light pressure, and to be truthful, most chiropractors won't take the time to learn how to do this because it takes more time. Usually I spend 20 to 30 minutes with the patient, and a lot of times chiropractic's about getting in and out and adjusting the spine and the pelvis, but this is more of a fascia thing, and it ties in with the head. And out of the chiropractors in the United States, about 1% do the cranial work, and then out of those 1%, I'm probably one of the 1% that does this type of work. So there's not a lot of people that do it, and not a lot of people that know how to do it. But I did learn how to do it, and so if you want to get checked, give us a call at 715-341-7102, and I'll check to see if it looks like we can help your, hand arthritis, and I'll do my best to fix it if you decide to come and see me.
I'm a patient of Dr. Powers, Powers Chiropractic, and I've had migraines for 35 years. I'm 66 now, and I had them starting out around once or twice a month. And when I first saw Dr. Powers, I was having them up to 3 times a week. And now I haven't had a migraine since 7 weeks ago. And I will have mild ones, but those migraines are gone, and I'm very appreciative.